it's CJ. Welcome to the 10th week of your pregnancy. You're officially 1/4 of the way to your due date. Today I'm going to let you know what's happening with your tiny human, some of the more common symptoms that you may be experiencing, what you can do to alleviate some of those symptoms, and what symptoms are not okay. If you stick around, I will also let you know what you can expect if you have an OB visit scheduled for this week. Inside of your uterus, your baby no longer has a tail. He or she now weighs about 35 grams or 1.2 ounces and is measuring about 3.1 centimeters or 1.2 inches from the top of their head to the bottom of their booty. That is what's known as a crown rump length. Essentially, your baby is the same size as a strawberry. This week, the main structures of the eye are being developed, and your baby is creating his or her own unique little set of fingerprints. The heart continues to beat 140 to 170 times per minute. If you have an ultrasound this week, you will see a fetus that is very, very active, although it's still a little bit too early to be feeling that. You still have a lot of hormones that are keeping your pregnancy going. In fact, in week 10, the hormone levels are at their highest, which means if you are having symptoms, they are probably at their worst. Here are the 7 most common symptoms that you can expect and what you can do to help with those. Number 1, nausea with or without vomiting. I encourage you to eat small, frequent meals throughout the day. Avoid foods that are greasy and spicy. If all else fails, talk to your OB provider about medications that can help with your symptoms. Number 2, you may feel dizzy or lightheaded. Make sure you're drinking plenty of water and try not to get up from a sitting position too quickly. Number 3, mood swings. Make sure you're getting plenty of rest and understand those symptoms will start to get better in a few weeks. Number 4, you may have excess saliva, which can create a metallic taste in your mouth. You can try eating peppermint candies and again, making sure you're staying really, really well hydrated. Number 5, you may have prominent veins on your breasts and on your tummy. There's nothing you can do about that. Those are normal. Number 6, you may be noticing that your pants are getting a little bit snug as your tummy's starting to get a little bit thicker. You might want to switch to leggings or stretch pants to accommodate that growing tummy. And number 7, because of the pregnancy hormones, you might have noticed an increase in your vaginal discharge. It is normally clear, white, and doesn't have an odor. If you are having a discharge that is green, stinky, or itchy, you do need to talk to your provider about that. It could be some form of vaginitis. So what symptoms are not okay? If you are having bright red bleeding that's enough to saturate a pad in an hour, if you are having cramping that won't go away, severe pain of any kind, if you can't keep any food down or you are vomiting several times a day for several days in a row, please let your provider know right away. Now, if you are carrying more than one baby, it is very common for your symptoms to be even more intense. You are probably extraordinarily tired and having a difficult time keeping any food down. And as far as a baby bump, yeah, you probably have one now. So if you have an OB visit scheduled for this week, here's what you can expect. If this is your first visit, they're going to have you fill out paperwork. They're going to get a thorough history. They're going to talk to you about genetic testing options. And if you have not already had an ultrasound, they may do one that day. You will most likely have some form of a physical exam. And if your cervical cancer screening is due, they may offer you a pap smear. If this is not your first visit and you are carrying more than one baby, they will definitely do an ultrasound to get both babies' heart rates. If you are carrying just one baby and you have already had an ultrasound, they will listen to the baby's heartbeat with a Doppler. And if you have not already had your genetic testing done, that will be done at that visit. And finally, hopefully your provider will be able to answer all of the questions that you and your partner have. In the meantime, if there's any questions that I can answer for you, please feel free to drop those in the comment section below. And while you're in that comment section, if you want to hit the like button or even share this video, I sure would appreciate that. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.